Quiet on the set, quiet on the set.
It is causing trouble.
Thank you for joining today for our Wednesday COVID-19 briefing, where we will provide information to Tennesseans about what it is that we're doing across the state and our efforts to mitigate the spread of COVID and our efforts to begin the planning process for opening up our economy. Yesterday, we did not have a briefing here, but we held that briefing in Chattanooga because, as you know, severe storms made their way through southeast Tennessee, particularly in Marion, in Hamilton, in Bradley, and Polk counties. There was significant damage, loss of life, a tremendous tragedy in that part of our state. We were there yesterday to survey and to travel through one of the hardest hit neighborhoods, and let me just say, our hearts and our prayers go out, along with thousands of Tennesseans, go out to the residents of southeast Tennessee that were affected by these storms. There was tremendous loss, tremendous tragedy, but we not only stand behind you and will work with you in your cleanup and rebuilding efforts, but to that effect, we are working very hard on the ground right now. So the national director of FEMA reached out to me early Monday morning after the storms, which began the process of FEMA coordinating with TEMA, federal level, state level, but most importantly, the local level went right to work. The emergency management associations there in Hamilton County and in Bradley County in particular, the hardest hit communities. Those agencies, along with the mayors and those in Chattanooga and Hamilton and in the adjoining counties, are working together. It's an incredibly coordinated effort there. The private sector, the nonprofit community as well joining in. We are doing assessments right now. Patrick Sheehan will give an update on our work there on the ground in that part of the state at the end of this briefing. But we will be preparing a declaration, an emergency declaration, to begin the process of providing relief for individuals, for those public utilities and the entities that will require relief at the end of this storm. So again, our greatest concern goes to those who are facing a tragedy on top of this pandemic in those counties in Tennessee. Today, we have 6,079 confirmed cases of COVID-19. We have lost 135 Tennesseans to COVID, and 2,196 Tennesseans have recovered. So during this briefing today, I want to talk primarily about two things. One is our decisions regarding the remainder of the school year, and the other to discuss Unified Command's efforts to rapidly expand COVID-19 testing here in Tennessee. Regarding schools, today I'm officially recommending that schools remain closed through the end of the school year. Our Department of Education will work with local leaders. We want to make sure that there is flexibility for districts all across the state as they have critical year-end activities that they need to complete and to begin, in fact, preparing for next year. This pandemic has created many challenges for families and for teachers and for students. And classroom time has been lost. Students have lost a significant amount of learning time, and we are committed to continuing to provide resources that will keep our students engaged over this next several weeks while they will not be in school buildings. We've talked at length in previous briefings about those initiatives that we put in place to make sure that academics continue in our state. But time lost in the classroom also has implications beyond academics, and those implications are often the well-being of children. Schools and teachers are often the front lines in caring for students, particularly those that are in difficult situations, those that are most vulnerable, those that are most at risk. And as a state, it will take all of us to ensure the safety and the well-being of our children during the time that they are not in the structured environment of a classroom. That's why I've asked our Education Commissioner, Penny Schwinn, to convene a COVID-19 Child Wellbeing Task Force to focus on providing support through state and local leaders to support communities as we work together to check on our kids after extended time away from the classroom. Penny Schwinn will be giving more information about that, but as that task force is convened, they will develop a strategy to make sure that we can support local communities and we can give guidance to how those local communities can make sure that our kids are safe over the next weeks and throughout the summer. On Monday, I spoke about the desire to get Tennesseans back to work and talked about our efforts by standing up an economic recovery group. But as we look to reboot our state's economy, we have to have a greater understanding of how this virus is operating in Tennessee. So I've directed our Unified Command Group to rapidly expand our COVID-19 testing capacity all across Tennessee. This will enable more Tennesseans to have greater access to testing. This increased testing capacity will empower our citizens to make decisions around their health as they consider how it is that they will get back into the workforce as we take steps to open up the economy. I spend time every week, a couple times a week, with governors across the country, and states are grappling with the availability of tests, with the supplies needed to give these tests, and with the turnaround time associated with tests. Rapid improvements to our testing apparatus has allowed the Unified Command Group to develop an expanded capacity and to offer targeted testing around the states. Our clinical understanding of COVID-19 is changing rapidly, and we need every Tennessean who isn't feeling well to understand that they have access to testing. Even when the traditional COVID-19 symptoms of fever or of cough or of shortness of breath, even beyond those traditional symptoms, we want Tennesseans who aren't feeling well to get tested. This expanded testing effort will launch this weekend, April 18th and 19th. The Tennessee National Guard will be popping up 15 drive-through testing sites all across the state. Drive-through testing sites will also be available during the weekends of April 25th and 26th and May 2nd and 3rd. The Department of Health nurses and Tennessee National Guard medics will perform these tests at the drive-through sites, and the results are projected to be delivered within 72 hours of testing. In addition to the drive-through testing sites that we'll be having on the weekends, Tennesseans need to remember that they can get a test free of charge 5 days a week at every state rural health department across every county in Tennessee. We encourage every Tennessean who isn't feeling well or who has come in contact with someone who has had COVID-19 to get a test. When in doubt, remember, when in doubt, get a test. I'll have Dr. Piercy come up in a few minutes and give a little more information about this expanded testing capacity across Tennessee, and details about the locations are available on the Department of Health website. During our briefing tomorrow, I'm going to give an update regarding our efforts to move forward with our economic recovery plans. But for now, I'd like to ask Commissioner Schwinn to come up and give additional details about how it is that we're going to keep kids learning and keep kids safe while we make a decision to keep kids out of the classroom for the remainder of the year. Penny?
We appreciate the governor's recommendation that schools remain closed through the end of the school year to protect the health and safety of all Tennesseans. This pandemic has impacted our children in ways we are only beginning to understand, and we have important work ahead. We must ensure our children continue learning. We will open schools next year, and students will enter their new grades. It's more important than ever before that our hard work continues, that we measure how students are doing, and we support them where they need it. Being out of school this long also has implications for the well-being of our students. It will take all of us to ensure the safety and well-being of children during times of closure. That's why I am proud to convene the COVID-19 Child Wellbeing Task Force to focus state and local leaders on the well-being of our students. It needs to be in place to help our communities come together and check on our kids. In recent weeks, we've been inspired by the ways that our communities have come together to solve tough challenges and support one another. Schools have been working together with local partners, churches, volunteers, school site staff, and more to deliver meals, instructional lessons, work packets to students. Policemen have been checking on students in their homes. Nonprofits are stepping up with critical supplies and supports now more than ever before. And we know that our teachers, our principals, and our superintendents are working hard to support our kids every single day. We've seen our districts go above and beyond to work with partners in their communities to take care of our kids, and our kids are counting on us. As a state, we want to help channel this type of energy, innovation, and problem solving. This new COVID-19 Child Wellbeing Task Force will be assembled in the coming weeks to encourage and support locally led innovations and partnerships to check on children and to ensure they are safe and well. Our vision is that every Tennessee community, schools, together with community partners, volunteers, churches, nonprofits, and school and district staff, have the creative thinking, the know-how, and the partnerships, the energy, and the commitment to children to lean into this challenge and to serve all of our students to the best possible ability. They've been doing an exceptional job during these times of school closures, and I know that we will continue to do that work for our kids. They are counting on us. I really appreciate it. Thank you.
Thank you, Commissioner. Certainly the education of our children and their well-being is an investment in the future of Tennessee, and we are committed to that future for our kids. So thank you, Commissioner. Dr. Piercy, if you would come up and give a health report.
Thank you, Governor. Good afternoon. As the Governor mentioned, our case count today is 6,079. That represents a 4.4% increase from yesterday, and we are approaching 81,000 tests. The good news is that almost 2,200 Tennesseans have recovered, and more are recovering by the day. As he mentioned, we're rolling out a new testing strategy, and we know that widespread testing and contact tracing are the keys for guiding our efforts not only to protect health and well-being, but to also take the steps to reopen our economy. We've talked a lot about testing in the past, but let me tell you what's different. First of all, we have expanded testing criteria. As he referenced, you no longer have to have those classic symptoms of fever, cough, or shortness of breath to qualify for testing. Essentially, if you think you need a test, we will test you. If you're confused about what the symptoms might be or want more information, I encourage you to check out the Department of Health's website or social media for a list of expanded symptoms that could indicate that you might be infected. Likewise, sometimes we know that people just don't feel right, or they might be what we call an asymptomatic or pre-symptomatic carrier. Again, I will stress, if you think you need a test, come out and get one because we're ready to test you. Something else that's different are that we're expanding the number of sites and dates that we're doing testing. In addition to all of the testing at our rural county health departments, these expanded sites that are going to be stood up this weekend and the next 2 weekends through the very valuable help of our partners, Tennessee National Guard, will allow for weekend testing. We understand that there are a lot of essential workers and other folks who may not be able to get testing access during the week, and so we're offering these weekend hours for additional convenience. Lastly, something else that's different, or at least it's not necessarily different, but I want to highlight it, is expanded access. These are free of charge, and so we don't want any financial or monetary barriers or insurance barriers to be put up between you if you think you need a test and actually getting that. So we are expanding the access even to the uninsured because we want to know the testing status of all of those who think they need it. Finally, I will remind you that when you look at that list, and your county or your city is not on there, please know that we are trying to cover every corner of the state. If your area is not on the list this weekend, you're welcome to go to a different area. You're not constrained by what the county you live in or the city that the test is in. You can go to any of these sites regardless of where you live. But if you want something that's a little more convenient or closer to home, stay tuned because we'll have a new list next weekend, and we're trying to cover all of those areas. So if your site is not on that list, it is probably coming soon. I'll stand by for questions. Thanks.
And again, I'll remind folks that there is testing throughout the week at every health department, available in every one of our 95 counties. I'd now like to ask Patrick Sheehan, the Director of TEMA, to come up and give an update on the tragedy of the storms in southeast Tennessee.
Thank you, Governor. As we saw yesterday, hundreds, if not thousands, of structures were damaged with terrible loss of life. We were able to see, however, the value of effective partnerships and the investments that those communities have taken in having a strong emergency management system and the willingness of the cities and the counties to work together within their boundaries and without, and to work with the state. And those investments, those thousands of hours spent training and exercising, you could really see them paying off with how quickly everyone worked together, both in their local emergency operations centers and out in the field supporting those who suffered terrible devastation to their property, some injuries, and to life. Power outages this morning were 23,000 in Hamilton County were still without power, and just before I walked in here, that number was down to 17,000. And so that is a testament to the effective work that's being done by EPB, supported by TVA and power companies who have mutual aid agreements throughout the southeastern United States. And Bradley County, by this evening, by sundown, is supposed to have all power restored to all structures that are sufficient enough to have to be able to have connections. Just real quick, I'd like to thank all the law enforcement officers, the state troopers, the EMTs, firefighters, linemen, volunteers, doctors, nurses, other medical personnel, businesses that have supported these survivors. And to the survivors and to the victims and to the victims' families, we just offer our prayers and our thoughts are with you. And the state of Tennessee is going to do everything we can, and your local leadership is doing everything they can. And the federal government has been very flexible in supporting us. We've already conducted damage assessments in 2 of the counties. We have 2 more that we'll work to complete quickly. And we know that there's damages in 17 other counties, and we'll be working with those leaders and those emergency managers to conduct assessments there as well. And to homeowners, to anyone that's listening right now, please make sure you document everything that you've lost. Take lots of pictures of everything that you've lost, and take pictures as you make progress. And then if you have not already, contact your insurance company. Commissioner Minda and his team have already been working with insurance companies, and in the area there are a number of places where carriers already are. If your agent is there in the area, make sure you're contacting them, and if they haven't gotten with you already, they should. But document everything and take lots of pictures, and just know that our thoughts and prayers are with you. And
Thank you.
Thank you, Governor.
Thank you. Appreciate the hard work of all of those that are helping the folks in southeast Tennessee, and the hard work of all of those who are working across our state, particularly those in the on the front lines, the first responders, our healthcare workers that are putting themselves on the line to take care of COVID patients, to test, to serve. There are many that are stepping up as Tennesseans to address the multiple challenges that we have all across our state, and we're grateful for every single one of those. So we'll be glad to answer questions. And we have members of Unified Command Group here, the National Guard, TEMA, Department of Health, Department of Education, so we're prepared to answer questions.
Thank you, Governor. First, we'll go to Joel Ebert with the Tennessean. Joel, your line is open.
Yeah, Governor, I just wanted to know, how is the state going to be able to provide all these tests? Where are these, this, I imagine, a mass amount of tests coming from, and why is now the time? Why wasn't it a week, 2 weeks ago? And then secondly, if I'm an essential worker, which us reporters are deemed as such, but we're healthy, should we be tested given that we're going out in the community?
I'll let you add if you need to, Dr. Piercy, but as you know, testing has been a real challenge in this country. The resources available to states from one end of the country to the other have been very limited. And we've had to be very resourceful to pursue testing in Tennessee. We have been encouraged by the private sector part of our community that has stepped up to allow us to have this access to increased testing capacity. We've worked really hard through our Unified Command Group to search out those vendors and those suppliers that can give us the needed equipment and needed supplies. And those efforts are paying off. That's why we're available now to have expanded access to testing. There were limited supplies earlier, but we've known that this was an important part of preparing for opening the economy back up in a measured way. We knew that we had to have expanded capacity to do that, and that's why we've put our strong efforts there, and it's now paying off. So now we do have we're beginning to accumulate more and more of those resources. We're continuing to utilize Launch Tennessee, which is an effort. It's a partnership with that organization to engage the private sector across our state to help us with anything from PPE to testing supplies. Those efforts have been fruitful, and it's given us the opportunity to expand this testing. And I would say, Joel, if you feel like you need a test because of your interaction with folks that, or anyone, any journalist, anyone that interacts with more people than is traditionally the case of someone who's staying at home and not interacting with the public as much, then you certainly ought to go out there and get tested.
And can you just clarify, do you have a number of how many tests are going to be available like this weekend, just as a mass stockpile?
Yeah.
Yeah, to add what the governor said, the testing swab availability, not only have we been able to procure more through our supply chain and our partners at TEMA, but there's also been an expansion of what is allowable per CDC standards. So they've expanded the list of the kinds of swabs that you can use and some of the other supplies in the testing process. So that will help us, that's what has helped us to expand our capacity. And that is related to your question, because your question about how many are we going to be able to do, really the rate limiting step is just hours and manpower at this point. I'm not asserting that we have unlimited supplies, because we do not, but for the hours that we have, there is some amount of time that it takes people to drive up, go through the process, get swabbed, get their information, and get out of line. And so that is the rate limiting step, is just the throughput of that. And so we're doing everything we can to minimize that throughput time, but that will be the rate limiting step.
Thank you.
Mm-hmm.
Next, we'll go to Kim Crucy with the Associated Press. Kim, your line is open.
Hey, Governor. I guess my question is regarding the school closure recommendation. At this point, why make it a recommendation when you have extended the mandated safer at home order until April 30th? Why is this continuing to be a recommendation and not an order?
Yeah, we know that school districts have decisions to make on their own, but we expect that in the same way that we recommended schools close the first time, that those schools will close across the state. We expect kids all across Tennessee not to go back to the classroom.
But if you're expecting all schools to follow this, why not just make it why give schools the option that if you're not expecting anyone to opt out?
Because we think it's important that districts, that we're supporting districts' efforts. That's important to us. The school districts uniquely know their own communities and what their end-of-year school requirements are, but we feel confident that school districts will close all across the state.
So you would be supportive of a school that chose to not follow this recommendation?
But we certainly would want to talk with them about that and understand fully why they might choose that. We don't expect that to happen.
Gotcha. Thank you.
Mm-hmm.
Next, we'll go to Chris Bungard with WKRN. Chris, your line is open.
Thank you, Governor, for taking my question. How much pressure do you feel to open up some of the state next week? And what has your economic recovery group been telling you? I know you're going to have some more tomorrow, but can you offer us a preview?
Well, our economic recovery group was formed yesterday, and they were tasked yesterday with beginning to develop those steps. And we have the stay-at-home order applies through the 30th. And we expect over that period of time that those steps will be defined, and there's a lot of input that we want to receive before we make decisions about what those steps are. We need the healthcare community to weigh in heavily. We need the business community to weigh in heavily. We need our local elected officials who are leaders in their individual communities to weigh in heavily. And that's why we are reaching out daily, multiple times a day with different groups, asking for their input so that we can develop a plan that's just right for our state, the uniqueness of Tennessee. Our state's different from every other state. Our geographic regions have seen different results with regard to COVID. So that's going to be the strategy, and they'll be delivering those recommendations in steps over the next couple weeks.
And I apologize, I may have said next week, I meant May 1st, and I just want a quick follow-up. Will some of the state be open May 1st?
You know, we are waiting on the recommendations. That's our goal, is to open in May, but it depends on what the recommendations of the healthcare community, the business community, our elected officials, all of those things that will be important to make sure that the most important thing is to make sure that Tennesseans' lives are protected and safe. We are really pleased with what we have done so far and how we believe it has worked. Tennesseans have been incredibly responsive to the suggestions and to the guidance and to the requirements that have been laid out there. It's working. Our curve is flattened. Our numbers are going in the right direction. We need some more confirmation of those numbers in the right direction. They haven't been turned downward, and we need some of those hospitalization numbers to not only stabilize but to turn downward. There are a number of things that have to happen, and we're very encouraged that what we have done has worked. And it's really important that in order for us to get to a place where people can begin to go back to work safely, that we finish this last term appropriately, and that we plan it very well, very measured, very smart, very strategic. That's the goal.
Thank you, Governor.
Next, we'll go to Marta Aldrich with Chalkbeat. Marta, your line is open.
Thank you. My question is related to schools. Tennessee will see a significant loss of learning as a result of these extended closures, and mostly affecting the students who are already furthest behind. So what recommendations will the state give school districts about how they can help students to catch up, perhaps in the way of holding summer learning programs, possibly starting next school year early? And related to that, how can districts pay for those recovery efforts, given that they likely will have to cut their budgets because of the economic slowdown happening and sluggish revenues?
So regarding times of school openings in the fall and changes to school calendars, we're going to be working with the legislature and to determine recommendations that the legislature would have regarding calendar days with regard to schools. So that's how I would answer the first part of that question. I spoke with the Secretary of Education with the federal government, Secretary DeVos, today about funding sources for education for states across the country. As you know, the federal funding packages are being delivered right now. They're being negotiated in Congress, but some decisions have already been made. We expect to get information about that funding stream and about the particular ways that the Tennessee education system can expect to receive federal funding to make up for some of the shortfalls and the budget challenges that districts will face. We don't have the information from that yet, but it's forthcoming, and we expect it frankly, we expect it any day now. Not particulars about how districts will receive that, but the types of funding and the amounts of funding that we'll be receiving from the federal government.
Thank you.
Next, we'll go to Sam Stockard with the Daily Memphian. Sam, your line is open.
Yeah, thanks, Governor. I appreciate your time. TennCare is saying that the CMS is probably not going to approve the state's Medicaid waiver request for treating uninsured people with the COVID-19. Do you have a backup to pay for that treatment, and what is it?
I spoke today with Seema Verma, who is the administrator for CMS at the federal level, to ask specifically how it is that we can cover the uninsured for costs and treatment related to COVID, because we're committed to that. And we talked about the federal package that's coming and their strategy to provide through that federal package funding for the uninsured. Again, the particulars of that were not laid out in that phone call today, but I received assurance from CMS that we would be able to cover expenses, COVID-related expenses for the uninsured. We're committed to that.
Is that through the CARES Act?
It's through the CARES Act, yes.
So you feel like it will be enough?
We do. We're certainly waiting to see what it would be. I can't, until we know what the numbers are, it'll be difficult for us to assess. But it's the federal government's intent to provide funding appropriate for states to cover their uninsured, and it's our intent as well, so we expect the funding will be there.
Thank you.
Next, we'll go to Megan Magrum with the Times Free Press. Megan, your line is open. Megan Magrum, your line is open. Sorry, we'll go to Andy Scher with the Times Free Press. Andy, your line is open.
All right, thank you very much. I've got a two-part question and maybe a follow-up, Hamilton County specific. One is that there have been questions raised down there because they didn't sound sirens during the tornado alert, and so a lot of people were totally unaware of what was going on. And part of that, I guess, is an issue related to TVA, which has all there are all these sirens in case there's a nuclear incident. But what do you think can and should be done in order to resolve notification issues there? And then secondly, getting to testing, they're still having problems in Hamilton County, which you've noted previously, in getting widespread testing. And they were saying, just today, the local task force chairwoman was saying that there are some new sites, but widespread testing remains, a key focus of the group. It's still not enough, and here we are. We're doing all these things for rural areas, but you got a couple of 100,000 people in that area.
Yeah, let me
Hamilton
just.
County. Is there any sort of specific aid, or why not a testing site or two there?
Yeah, well, we are at our State Department of Health, and I'll let Dr. Piercy specifically address that region. But through our State Department, we are coordinating with local officials in every part of our state to make sure that we have access for Tennesseans to get testing. We certainly have been working with the local officials there to make sure that there's sufficient testing in Hamilton County and in the surrounding counties. And as the resources become more widely available, which they are, that's the reason that we're able to bring up additional testing sites. We expect that's going to happen in every community in the state, that there will be greater access to testing. But Dr. Pierce, you want to talk specifically about Hamilton?
Sure. To be honest, Hamilton County was on our list for both Saturday and Sunday when we first started planning this, and then the unfortunate weather-related events occurred, and so they have asked us to push that out for a few days, if not maybe until next weekend, until they're better able to support our testing site there with local county personnel. While that is understandable, we have to remember that there are a lot of people dealing with some very serious things right now, and so we want to be respectful of that and then get them back to normal just as quickly as possible. I'll defer to Patrick on the tornado sirens.
Hey, Andy, so there's always debate when a tornado or severe weather happens about the appropriate use of sirens. And sirens, no matter what the event is, they're designed to be an outdoor warning system. And especially with newer homes that are more soundproof, sirens are often not going to be heard inside a home. And so while I'm sure folks have questions, the storms didn't hit there until after midnight and didn't cause the damage they did until after midnight. And sirens would not have been a great tool there. So, I think the mayor talked about it. They have an app that people can sign up for there in Hamilton County to be able to get alerts and notifications. Cell phones with the wireless emergency alerting systems are a great way to make sure that warnings can get out, but the best answer for anybody, and I think Mayor Coppinger talked about this a lot in the last 2 days, is just having an inexpensive NOAA weather radio in your home with a battery backup is the best way to make sure that you can get a timely warning when severe weather, whether that's a tornado or just a strong thunderstorm, is headed your way.
Thank you, Patrick.
What about people who, if I can follow up, what about people who don't have a cell phone? Not everybody has one. I know people who live there who don't,
Sure. As you know, too, Andy, that is increasingly rare. There is a sign-up system there in Hamilton County, and this is, of course, a local issue, but in Hamilton County specifically, they have a system where they can register their telephone number and get telephonic alerts. But again, a $40 weather radio from any number of reputable companies is the best way to get a warning.
Thanks, Andy.
Next, we'll go to Sergio Martinez Beltran from WPLN. Sergio, your line is open. Sergio, your line is open.
We lost
Hello?
Sergio.
Can you hear me?
Yes, sir, we can, Sergio.
Oh, sorry for that. Thank you, Governor, and thank you, Gil. My questions are actually for Commissioner Fiercy. Commissioner, you talked about how, you didn't offer specific numbers of how many tests there are going to be for this weekend for these mass events. Are you not concerned that you might have to start turning people away because there's not enough tests?
That's a fair question, and that's something we've had extensive conversation about. So to give you an actual number, we are able to process about 1 car every 5 minutes. What we don't know is we don't know what the demand is going to be. We've had pretty good testing availability already, but we recognize that this is a significant expansion of what we've been doing. So we've made some contingency plans on, what happens if 200 people show up right when we open, or if there's still 75 cars in line when we close down. We've got contingencies for both of those, but the most important thing to remember is this testing in its expanded state is still available Monday through Friday at all local health departments. So if for some reason somebody's not able to get out on the weekend, or if they just aren't able to be seen, and I think that would be pretty rare, they still have that same capability at all of our health departments any day of the week, just like they always have. So there is a plan for overflow and contingency if it comes to that.
And I have a follow-up question, Commissioner. You talked about, those people who don't see their counties on the website, they can go to another county and get tested. The reality is that in Shelby, Davidson counties, a lot of people might have issues with mobility. It might not be easy for them to get tested in the neighboring county. Is the state doing anything for these other counties that are not getting a drive-through testing service this weekend? Should we expect them to have services the next time?
Yeah, so like I said in my earlier comments, if your county or local area is not on this week's list, it very likely will be on the next week or the following week. In addition to those special sites, every county has a health department that has testing, and quite frankly, there's a lot of private sector testing going on in addition. I will send your listeners back to our website. We have a compiled directory on the Department of Health website that lists all of the sites. We've actually had that up for 3 or 4 weeks now, and so those are available all of the time, not just on the weekend. And so many of the places that have many of the urban centers that you referenced have many remote sites in various parts of town that are available through public transportation and other mechanisms. And so, as I mentioned earlier, our number one priority is reducing any barrier to accessing this testing.
Thank you.
Next, we'll go to Jeremy Finley with WSMV. Jeremy, your line is open.
All right, thank you for taking my questions, Governor. This has to do with the contact tracing. I wanted to know if you have an exact number of how many people you are tracing across the state that have come in contact with someone who has tested positive. That's the first part of my question, is that exact number. The second part is, so many rural health departments are the ones that are handling this. Do they have the capability of also tracing all of the people who may have had contact with someone who has tested positive? Is that realistic for a rural health department to also take on that obligation? Thanks.
I'll let Dr. Piercy answer that.
So it's actually an interesting question about how many people are out there that we're tracing. My epidemiologist may know that cumulative number. I haven't heard that. It would be in, I would venture to guess it would be in the tens of thousands. Because if you think about, at least before we implemented social distancing, how many people you were in contact with on a daily basis. Obviously the number is less now, but still that can be 10 or 20 or more per person. And if you've seen some of those graphics where it shows the exponential increase based on each one, that can get overwhelming really quickly. So to the second part of your question, rural health departments have never attempted anything on this scale. And we recognize that and realize that they, like everywhere else in the country, are getting behind in their numbers. It's just a physical manpower issue. And that's why we've been working very closely with our partners in state government and even outside of state government to expand the number of contact tracing personnel. I am shooting to bring on an additional 150 contact tracing staff next week and then have additional plans for cohorts in the future for those staff members to be able to call and trace because we know that contact tracing, in addition to testing, is one of the primary ways that we're going to be able to move on even despite this disease.
Doctor, can I have a quick follow-up question, and thank you for answering that. Representative Mike Stewart said he's been asking repeatedly for the plan to do contact tracing. Do you have a plan finalized?
We've had a plan finalized for a long time, and I'm happy to discuss that at length with anybody who wants to talk about that.
That's all the time we have for questions today. Governor, if you would like to make a closing statement.
Thank you again for joining us. We will continue the daily briefings to continue to provide you information on the multiple things that are happening across our state. Be encouraged. We certainly know that what you are doing out there is working. It is allowing us, because of what you're doing, because of the fact that it is working, it's allowing us to make plans for the future. And those plans are coming together. We will be able to take substantive steps forward in opening our state's economy as a result of the efforts that you're making. So continue to do just that, do your part and stay apart. Thank you very much for joining us again today.